If you are over 60 years old and you sit on the toilet the way most people in the Western world have been sitting their entire lives, I need to tell you something that could prevent a medical emergency. Because the standard sitting position on a modern toilet, knees at 90 degrees, back upright or slightly hunched forward, is working against your body's anatomy in a way that creates real, measurable, and sometimes catastrophic health consequences. And after the age of 60, when your muscles are weaker, your blood vessels are more fragile, and your digestive system is slower, these consequences become dramatically more dangerous. I know this sounds unlikely. You have been using a toilet the same way for decades, and it has never caused a problem that you know of. But the damage from improper toilet posture is cumulative and often invisible until it manifests as hemorrhoids, chronic constipation, pelvic floor dysfunction, or in worst-case scenarios, a straining-induced cardiac event. And every single one of these conditions is preventable with a simple change in positioning. Let me explain exactly what is happening inside your body when you sit on a standard toilet in the conventional upright position, and why this position is fundamentally incompatible with how your anatomy was designed to eliminate waste. The key structure you need to understand is called the puborectalis muscle. This is a U-shaped muscle that wraps around the lower part of your rectum like a sling. When you are standing or sitting upright, this muscle is contracted, creating a kink in the rectal canal, essentially bending it at an angle of approximately 90 degrees. This kink is absolutely essential. It is your body's natural continence mechanism. Without it, you would not be able to hold your bowel movements. The puborectalis muscle maintains this kink 24 hours a day, 7 days a week, keeping the rectal canal closed and preventing accidental leakage. Here is the problem. When you sit on a modern toilet with your knees at approximately 90 degrees to your hips, the puborectalis muscle only partially relaxes. The kink in your rectal canal does not fully straighten out. This means you are trying to push stool through a partially kinked tube. It is like trying to squeeze toothpaste through a hose that is bent in the middle. The toothpaste can get through, but it requires significantly more force than if the hose were straight. That extra force, that straining, is where the serious health problems begin. When you strain to have a bowel movement, you are performing what is called a Valsalva maneuver. You close your glottis, hold your breath, and bear down with your abdominal muscles. This creates a dramatic spike in intra-abdominal pressure, which in turn creates sudden spikes in blood pressure and intrathoracic pressure. In a healthy 30-year-old, these pressure spikes are usually tolerated without consequence. But in someone over 60 with stiffened arteries, weakened blood vessel walls, or pre-existing cardiovascular disease, these pressure spikes can be genuinely dangerous. Straining on the toilet has been documented as a trigger for heart attacks, strokes, aortic dissection, and fatal cardiac arrhythmias. This is not speculation. It is published medical literature. A study in the European Journal of Cardiovascular Prevention documented that defecation-related straining was responsible for a measurable percentage of acute cardiovascular events in elderly patients. The Japanese even have a word for it. There is a recognized pattern of sudden cardiac death occurring during or immediately after straining on the toilet, and it disproportionately affects older adults. Beyond the cardiovascular risks, chronic straining is the primary driver of several other conditions that plague seniors. Hemorrhoids, those swollen, painful blood vessels around the anus and lower rectum, are directly caused by repeated increases in venous pressure from straining. By the age of 50, roughly half the population has experienced hemorrhoid symptoms, and the prevalence only increases from there. Hemorrhoids can bleed, itch, cause pain, and in severe cases require surgical intervention, and they are almost entirely preventable with proper toilet posture and elimination of straining. Rectal prolapse is another condition linked to chronic straining, particularly in older women. In this condition, the rectum actually telescopes out through the anus due to weakened pelvic floor muscles and repeated downward pressure. It is distressing, uncomfortable, and often requires surgery to repair. Pelvic organ prolapse, where the bladder, uterus, or rectum descend from their normal positions, is also exacerbated by years of straining during bowel movements. Diverticular disease is yet another consequence. The increased intra-abdominal pressure from chronic straining pushes against weak spots in the colon wall, creating small pouches called diverticula. These pouches can become inflamed or infected, a painful condition called diverticulitis that sometimes requires hospitalization and even emergency surgery. By the age of 60, approximately 50% of people in Western countries have diverticula, and this prevalence rises to nearly 70% by age 80. So what is the solution? It is remarkably simple and it costs almost nothing. You need to raise your knees above your hips when you sit on the toilet. This is called the squatting position, and it is the position that humans used for hundreds of thousands of years before the invention of the modern seated toilet in the 18th and 19th centuries. When your knees are elevated above your hips, ideally at an angle of approximately 35 degrees between your thighs and your torso, the puborectalis muscle fully relaxes. The kink in the rectal canal straightens out completely. The pathway for stool becomes a straight, open chute rather than a bent, kinked tube. The easiest way to achieve this position is with a simple footstool placed in front of your toilet. You sit on the toilet normally, then place your feet on the stool so that your knees come up above hip level. The stool does not need to be expensive or specialized. Any sturdy stool or box that is approximately 7 to 9 inches high will work. There are commercial products designed specifically for this purpose, but a stack of old books or a small step stool from your closet achieves the exact same biomechanical effect. The difference is immediate and dramatic. Most people who try the elevated knee position for the first time report that elimination is significantly easier, faster, and requires little to no straining. Clinical studies have confirmed this subjective experience. Research published in the Journal of Clinical Gastroenterology found that using a footstool to achieve a squatting-like position reduced straining, reduced time spent on the toilet, and improved the sensation of complete evacuation. Participants reported feeling like their bowels emptied more thoroughly, with less effort, and in less time. There are additional positioning tips that make a significant difference. Lean slightly forward from the hips, not from the waist, so that your torso tilts toward your thighs. Rest your elbows on your knees or your forearms on your thighs. This further relaxes the pelvic floor and opens the anorectal angle. Keep your mouth slightly open and avoid holding your breath. If you need to create abdominal pressure, use a gentle bulging of your lower abdomen rather than a forceful bearing down strain. Think of it as gently pushing outward with your belly rather than clenching and forcing. Breathing technique matters more than most people realize. Many people instinctively hold their breath and bear down hard when they feel resistance during a bowel movement. This is exactly the Valsalva maneuver I described earlier, and it is the most dangerous thing you can do on the toilet after age 60. Instead, practice what I call the exhale and release technique. Take a normal breath in, then slowly exhale through slightly pursed lips while gently allowing your abdomen to bulge outward. This creates a mild, sustained increase in abdominal pressure without the dangerous spikes in blood pressure and intrathoracic pressure that come from breath holding and hard straining. I also want to address timing, because rushing your bowel movements is another major contributor to straining. Your colon has natural rhythmic contractions called peristalsis that move stool toward the rectum. These contractions are strongest in the morning, typically within 30 to 60 minutes after waking and especially after eating breakfast. This is called the gastrocolic reflex. If you respond to this natural urge promptly and sit in the proper position, elimination usually requires minimal effort. But if you ignore the urge, delay your trip to the bathroom, or try to force a bowel movement at a time when your colon is not ready, you are much more likely to strain. Fiber and hydration are obviously important supporting factors. Adequate fiber, 25 to 30 grams per day from fruits, vegetables, whole grains, and legumes, creates soft, bulky stool that moves easily through the colon. Adequate water, at least 6 to 8 glasses per day, keeps stool hydrated and prevents the hard, dry consistency that makes evacuation difficult. But even with perfect fiber and hydration, the wrong toilet posture can still cause unnecessary straining. Conversely, even with suboptimal fiber intake, the correct posture can dramatically reduce the effort required for elimination. For those with mobility limitations, and I know many of my viewers are dealing with arthritis, hip replacements, knee problems, or balance issues, The footstool approach is still achievable with some modifications. Choose a stool with a non-slip surface. Make sure you feel stable and secure before adjusting your position. If raising both feet to the full height is uncomfortable, even a partial elevation makes a meaningful difference. Some people find that a shorter stool of 5 to 6 inches is more comfortable while still providing significant benefit. Grab bars mounted to the wall beside the toilet can provide additional stability and confidence. Let me share one more critical piece of information. If you are someone who takes blood pressure medication, blood thinners, or has been diagnosed with an aneurysm of any kind, proper toilet posture is not just a comfort issue, it is a safety issue. The pressure spikes from straining can interact dangerously with these conditions. Blood thinners increase the risk of hemorrhagic stroke during pressure spikes. Aneurysms can rupture under sudden increases in blood pressure. These are not theoretical risks. They are documented clinical events that emergency room physicians see regularly. The change I am asking you to make today is one of the simplest health interventions I have ever recommended. Get a footstool. Place it in front of your toilet. Put your feet on it so your knees come above your hips. Lean forward slightly. Breathe. Do not strain. That is it. This single change can prevent hemorrhoids, reduce your risk of rectal and pelvic organ prolapse, protect you from diverticular disease, and, most importantly, eliminate the dangerous blood pressure spikes that turn a routine bathroom visit into a potential cardiovascular emergency. Please share this information with your family, especially anyone over 60. It is one of those things that people do not talk about but desperately need to know. Subscribe to this channel for more health information that could genuinely change your life, and leave a comment below if you have experienced any of the issues I discussed today. I read every comment, and your experiences help other viewers feel less alone. Stay safe, stay informed, and take care of your body. It is the only one you have got. Let me tell you about a patient I will never forget. He was 72, active, generally healthy, and had been managing his blood pressure with medication for about 10 years. One morning, his wife found him collapsed on the bathroom floor. He had been straining during a bowel movement, experienced a sudden spike in blood pressure, and suffered a hemorrhagic stroke. He survived, but he lost significant function on his left side and required months of rehabilitation. When I spoke with him later, he told me he had been straining like that for years, every single day. He had no idea it was dangerous. Stories like his are tragically common, and they are completely preventable. I also want to discuss the connection between toilet posture and urinary health, particularly for men. The prostate gland enlarges with age in most men, a condition called benign prostatic hyperplasia, and this enlargement can make urination slower and more difficult. Many men with enlarged prostates find themselves straining to empty their bladder as well as their bowels. The elevated knee position that helps with bowel movements can also assist with urination by relaxing the pelvic floor muscles and reducing the resistance that an enlarged prostate creates. Some urologists now recommend the squatting-like posture for men with urinary symptoms, and studies have shown more complete bladder emptying in the elevated knee position. For women, the connection between toilet posture and pelvic health is even more significant. The pelvic floor muscles support the bladder, uterus, and rectum like a hammock. Decades of straining during bowel movement stretch and weaken these muscles, contributing to urinary incontinence, the involuntary leakage of urine that affects nearly 40% of women over the age of 60. Every time you strain on the toilet, you are pushing downward against these muscles with tremendous force. Over years, this repeated downward pressure can cause the pelvic floor to sag, allowing the organs it supports to descend. Adopting the elevated knee position eliminates or dramatically reduces straining, protecting the pelvic floor from this cumulative damage. Let me also address a common concern I hear from patients: spending too much time on the toilet. Many people sit on the toilet for 10, 15, or even 20 minutes, often scrolling through their phone while waiting for a bowel movement. This prolonged sitting is itself a risk factor for hemorrhoids, because the sitting position on a toilet concentrates body weight on the pelvic floor and creates increased venous pressure in the hemorrhoidal blood vessels. The ideal bowel movement should take no more than 3 to 5 minutes. If you are spending significantly longer than that, it usually means one of two things. Either you are not responding to your body's natural urge and trying to force a movement when your colon is not ready, or there is a functional problem with your elimination that needs medical evaluation. I want to share some additional practical advice for anyone who has already developed hemorrhoids or is experiencing pain during bowel movements. A sitz bath, sitting in a few inches of warm water for 10 to 15 minutes. After a bowel movement can provide tremendous relief by increasing blood flow to the area and relaxing the anal sphincter muscles. Over-the-counter preparations containing witch hazel can reduce swelling and provide temporary relief. And most importantly, do not delay having a bowel movement when you feel the urge. The longer stool sits in the rectum, the more water is absorbed from it, making it harder and more difficult to pass, which means more straining, which means more hemorrhoid aggravation. Respond to the urge promptly, use the elevated knee position, breathe properly, and the entire process becomes dramatically easier. Here is one more piece of information that connects everything I have discussed. The vagus nerve, one of the longest and most important nerves in your body, is directly stimulated during bowel movements. This nerve controls heart rate, blood pressure, and the transition between your fight or flight and rest and digest nervous system states. Excessive straining can trigger what is called a vasovagal response, a sudden drop in heart rate and blood pressure that can cause lightheadedness, fainting, and in vulnerable individuals, dangerous cardiac arrhythmias. This is why people occasionally faint on the toilet, and why straining-related cardiac events are a recognized phenomenon in emergency medicine. Proper toilet posture and breathing technique minimize the stimulation of the vagus nerve and reduce the risk of these vasovagal episodes. I also want to address the topic of laxatives because many seniors rely on them daily to manage constipation, and this dependence often develops precisely because they have been fighting against their anatomy with improper toilet posture for decades. While laxatives have their place as short-term solutions, chronic daily laxative use can create its own problems, including electrolyte imbalances, dehydration, and a condition called lazy bowel syndrome, where the colon becomes dependent on the laxative and loses its ability to contract effectively on its own. If you adopt proper toilet posture, increase your fiber and water intake, and respond to your body's natural urges promptly, many people find they can gradually reduce or eliminate their laxative use entirely. Of course, any changes to laxative use should be discussed with your doctor first. I need to address something that many people feel embarrassed to discuss but is critically important: the role of the pelvic floor in overall health. Your pelvic floor is not just one muscle. It is a complex network of muscles, ligaments, and connective tissue that spans the bottom of your pelvis like a trampoline. It supports your bladder, your bowel, and in women your uterus. It controls urination and defecation. It plays a role in sexual function. And every time you strain forcefully on the toilet, you are stretching and weakening this entire network. Pelvic floor physical therapy, a specialized form of physiotherapy focused on strengthening and coordinating these muscles, can be enormously beneficial for anyone who has been straining during bowel movements for years. Many hospitals and clinics now offer pelvic floor rehabilitation programs, and the exercises can be done at home once learned. Combined with proper toilet posture, pelvic floor exercises can reverse years of damage and restore normal function. There is one more anatomical detail worth understanding. The internal anal sphincter, the ring of smooth muscle that keeps the anus closed at rest, is under involuntary control, meaning you cannot consciously relax it. It relaxes reflexively when stool descends into the rectum and stretches the rectal wall. But here is the important part. This reflex relaxation only works efficiently when the anorectal angle is straightened by the squatting position. In the conventional sitting position, with the puborectalis muscle only partially relaxed, the internal sphincter receives conflicting signals. Part of the system is saying open, while part is saying stay kinked. This conflict is what makes people feel like they need to push harder. In the squatting position, everything aligns. The puborectalis relaxes, the anorectal angle straightens, the internal sphincter opens reflexively, and stool passes with minimal voluntary effort. I want to mention a topic that affects millions of seniors, but is rarely discussed publicly: fecal incontinence. This condition, the inability to control bowel movements, is far more common than most people realize, affecting an estimated 8 to 15% of adults over 60. While there are many causes, chronic straining is a significant contributor because it damages the pudendal nerve, which controls the external anal sphincter. Once this nerve is damaged, control over bowel movements diminishes. The elevated knee toilet position protects the pudendal nerve by eliminating the need for forceful straining, and it is one of the simplest measures available to reduce the risk of developing fecal incontinence as you age. Here is a practical summary that you can implement immediately. Place a 7 to 9 inch stool in front of your toilet tonight. Tomorrow morning, when you feel the natural urge, likely within 30 to 60 minutes of waking, sit down, place your feet on the stool, lean forward slightly, breathe normally, and allow gravity and your body's natural reflexes to do the work. Do not push. Do not hold your breath. If nothing happens within 3 to 5 minutes, stand up and walk around for a few minutes, then try again. This approach works with your anatomy instead of fighting against it, and the difference in ease and comfort will astonish you.